So good evening, everyone, and welcome to the December Pathway session on acupuncture and hypnotherapy. I'm Paul Reinhardt, and I'm the founder of the New Canaan Parent Support Group. And as most of you know, we hold weekly parent support meetings. We host monthly pathway sessions like this one. And we also host community events like our annual Addiction Awareness Vigil. And if you want to learn more about us, we have a Facebook page and we also have a website, ncparentsupportgroup.org. And so for the introduction, I wanted to just start with a definition of integrative medicine that I found online, and Joe can correct me because I probably have it wrong. But integrative medicine is a healing-oriented discipline that takes account of the whole person and makes use of complementary and alternative medicine therapies. And that, I believe that's also known by its acronym CAM. These CAM therapies are evidence-based and include acupuncture, diet, guided imagery, hypnotherapy, meditation, herbal supplements, therapeutic massage, and yoga. And again, Joe, when you speak, you can correct me, but just a few more details about our speaker this evening. Joseph Feuerstein, MD, is the Director of Integrative Medicine at Stamford Health. He is an assistant professor of clinical medicine at Columbia University and is certified in both clinical hypnosis and medical acupuncture. Joe is board certified in family medicine. He's a graduate of Cambridge and London universities. He's a combat surgeon and has completed a 2-year fellowship in integrative medicine at the University of Arizona, where he trained directly under Dr. Andrew Weil. And so after Joe speaks, and he does have a presentation, it would be great with our small group to have an interactive discussion. So there will be plenty of time for Q&A. And without further delay, I was wondering if you could join me in welcoming our speaker, Dr. Joseph Feuerstein.
Guys, thanks so much. I hope we don't have any technical issues. That is precisely what integrative medicine is. But I just want to use the word why we would use integrative. So the concept is that as opposed to an alternative, an integrative medicine approach is integrating evidence-based natural approaches into the Western treatment plan. So at Stanford, we're one of the largest centers in the country in terms of volume of patients that we see. And we work directly with physicians of almost every single specialty who are referring their patients because the patients don't want to take medication, can't take medication, medication doesn't work, or whatever the reason is. And so they want to know if we have something else as an alternative, but we're doing it in conjunction with them. So we are not doing that instead of, we're doing it in addition. And so you get the best out of what the Western approach is. And then there were all these other fascinating and very impactful, very powerful other approaches that can be used for various things. Everything doesn't work for everything. So that's what integrative medicine really is. So I'm going to talk more specifically about hypnosis, acupuncture, which I do really all the time, but more to do with anxiety and substance abuse, because the nature of the discussion, I'm going to go over some of the evidence for this. I think we'll do an experiential. We can't do acupuncture because nobody's in the room. If we were in, if the surge wasn't happening, we would have been able to have actually done, someone would volunteer and I would do acupuncture for them, but unfortunately that's not the case. But we can at least do some basic hypnotic experience so you can see what that feels like. So I'm going to just go over the different things. So the first thing we should talk about is acupuncture. And I just want to see if I can move that. Yeah. So just a definition of this, which is that it's the stimulation of points in the meridians of the body. I don't know whether anyone's been to Chinatown and ever seen an acupuncture statue and actually a model, but you'll see that there are 12 meridians, which are like lines that are going through specific parts of the body. And acupuncture is stimulating those meridians. And you're doing this by penetrating the skin. I'll show you what an acupuncture needle actually looks like, because I have some that we use for hypnosis all the time. So this is a typical looking acupuncture needle. This is a very, very small one. It's actually an auricular acupuncture needle. You have the needle itself, which is over here. Then you have the guide, which is easy, so it makes it easier to put in, because these are very fine needles and they go in the ear. It would be this type of needle we'd actually be using for auricular acupuncture, which is one of the things we do when we do hypnosis. And what we do is insert the needle, and then you manipulate the needle, which is part of getting the chi. And then you can, one other way of doing this is to add electrical stimulation with an electrical stimulating kit, and that will send a charge around a circuit that will stimulate it will stimulate the acupuncture needles and give a little bit of electricity, which can be useful in certain types of acupuncture treatments that we use. And clearly acupuncture is one of the key components of traditional Chinese medicine, and it's one of the oldest healing traditions in the world. So just a couple of things to just understand about meridians is, as I said before, there are 12 meridians in the body, and they do not correspond to any anatomical system that Western medicine can see. So if we were to cut through and look at the stomach meridian or the spleen meridian or something like that, you're not going to see anything when you're looking at it macroscopically, when you sit there and cut through in a lab for pathology, in an anatomy lab. We think probably that the meridians are actually in the fascia. And the fascia is the surrounding of the muscles. All muscles have surrounding them. There's this almost like a web that surrounds all the muscles, called the fascia. And it's funny because when I was in medical school, we used to just cut through it when we were in anatomy. But it turns out that fascia is incredibly important. It actually moves, and it's an incredibly important organ. And issues with the fascia will cause myofascial pain, which is one of the chronic pains that in our center we see all the time. So the meridians are probably in the fascia, and acupuncture works at various levels. We know it actually works at the level of the spinal cord. We know it works higher up in the brainstem and actually stimulates centers of the brain when we do this. The other concept in traditional Chinese medicine is one of qi, which is your life force. So Western medicine is really the only healing tradition that doesn't really even kind of contemplate the idea that there's a life force, but we all realize there's some kind of life force, because when you see someone who's passed away, they just don't have that. So what's the difference between a dead person and a living person? It's their life force. There's something going through the living person. It's not that when you see a dead person. And so in traditional Chinese medicine, it's called qi, and yana in Ayurveda, it's called prana. And so in traditional Chinese medicine, the idea is that this life force is flowing through these meridians, and it flows through each meridian for 2 hours a day. The meridians are actually in pairs. They're energetically connected. And so there's different meridians that are associated with different things. And what you are doing is stimulating the meridian to increase or decrease, to bring qi if there's a blockage, or to get things more in balance. And that's a completely different way of looking at pathology, a completely different way of looking at disease in the human than the Western approach. So traditional Chinese medicine is a healing system that has a different setup for what different diseases are, and they don't see it quite the same way as Western. So when we talk about, some of the data behind acupuncture. So just in terms of anxiety, this is most of the studies are quite old because frankly, there's not a lot of funding for these types of studies, but this was a study that was published in Anesthesia and Analgesia about 20 years ago. And what they were looking at is, the reason why I give you this study is because this is actually the points that I use in acupuncture specifically for anxiety and also for hypnosis. And they were randomized to auricular points, which are points in the ear. One of them, I'll show you the diagram in a second what they were. One of them is called Shenmen. The other one was called Relaxation Point. And then there was a sham acupuncture point, which is where you're putting in the acupuncture needle. It's actually not inserting in the skin. And what they found was that when they looked at this in terms of these volunteers, the relaxation point, which is one of the points I used, showed a statistically significant reduction in anxiety compared to the placebo, also compared to Shenmen. And so what the results of this study, done by anesthesiologists, was that auricular acupuncture would be especially the relaxation point, would reduce anxiety in healthy people. And the reason why this is important in hypnosis is because you need to get into a hypnotic state, you need to be relaxed. So you can't hypnotize anybody who's stressed or anxious. It just doesn't work. So the points that were used in the study, which is just to kind of give you some of these points, and again, it's a needle of this size and width. You can see relaxation point is there. It's right over here. And then we've got Shenmen, which is over here. And then they used another point, which was the sham point over here. Now, the interesting thing is the sham point actually is from an acupuncture point of view, is actually in an area that would stimulate some effect on the body, but it isn't going to have an anxiety relieving or a relaxing effect, unlike relaxation point in Shenmen. So that was kind of what they found from this study about 20 years ago. When I do acupuncture, I do use those 2 points. I use a relaxation point and I use Shenmen to help relax someone in order to be able to hypnotize them. So just to talk about acupuncture by itself, there is a fair amount of data for using auricular, again, ear acupuncture for substance abuse. And this is the NADA protocol, NADA, which is the National Acupuncture Detoxification Association. I'll show you the points, but it's 5 needles in each ear. Sometimes they just do 1 ear, but it's usually 5 needles in each ear, and they do it for 60 minutes. And these are the points. So what you can see is Shenmen again is used. That's up the top on the right-hand side. And then they have the sympathetic point, which is also called relaxation point. It's kind of in here again, which we use. And then there's other ones. And so you can see that when in the previous study, they randomly just put a sham point, they were actually probably stimulating a liver point, because you can see the liver point is on the right-hand side. Then you've got the lung and the kidney is at the top. And so those are the 5 points that are used for NADA. And I have to say, in my practice, I've certainly used NADA protocols for people with alcohol abuse and more often actually kind of more opiate abuse, heroin, etc. I've used this before. I find it quite useful. So does NADA work? Does this protocol work? And so here is the Archives of Internal Medicine. Again, this is all old studies because there is not a lot of data being done now in general, probably to do with funding. So this is 20 years ago again, and this is a randomized controlled trial using the same protocol. That's the 5 needles. And this was actually for cocaine use rather than for alcohol or for opiates. And so they take 82 cocaine-dependent methadone maintained, randomized into 3 groups. They have NADA, they have just a relaxation group that don't get any acupuncture, and then they have a placebo group that get needled, but they don't get any of the NADA needles. They just get other needles. And they're going to get this practically every day. They get it for 2 months, which is quite a long time. And then what they obviously do with any of the protocols where you're looking at substance abuse, you're always looking at recidivism. And the way to do that, to find out whether it works, is to have people, as is the case in methadone clinics, for people to give urine toxicology screening, so we can see if they are if they're clean. And what you found is that approximately more than three times more likely to abstain, to not to not return to cocaine use if you were using the NADA protocol compared to control needles, which is basically acupuncture needles in the wrong places, or a relaxation group. So NADA does have some data, and I know that it's used a lot in it was used a lot in New York hospitals. But that's kind of an interesting thing just in terms of acupuncture. So when we get onto the second thing, and then we'll talk about how we combine the two, you've got hypnosis. So hypnosis is it's actually it's a little ridiculous when people do stage hypnosis, because that is hypnosis, but they are belittling what actually has quite a lot of data and is quite a powerful tool. Most people, 90% of people, can enter what is called the hypnotic state, which is a trance-like state. Now, it doesn't mean that I'm going to make you, quack like a duck or rob a bank, because actually one of the fundamental things in hypnosis is that I can't actually make you do anything you don't want to do, because though we're accessing your subconscious, your conscious mind can always stop you doing a behavior that's completely abhorrent to you. So again, I can't hypnotize my kids to go clean their room, because that doesn't actually work, and I can't make you rob a bank or become my slave. The kid thing I would have done if I thought it helped. So the concept with this is that it's almost a duality, because you are focused on and concentrated on a specific thing, which is actually the sound of my voice, to the exclusion of other stimuli. So really, in this hypnotic state, you can really only hear me. You can't really hear everything else. And if you want to know what a trance feels like, when you drive to work and you suddenly realize that you got to work and you've been driving for 20 minutes, but you have no recollection of how you got there, but you didn't crash, and you were on autopilot, it was actually mostly in the subconscious realm. And that is actually like what a trance is. So in a hypnotic trance, in a hypnotic state, your subconscious is more open to what are called hypnotic suggestions. And that's kind of the main thing that we do in hypnosis. So just to kind of go over this, actually, these two points should be reversed. Hypnosis is used in pain disorders, so I use it for anxiety, I use it for stress eating, I use it for insomnia. I'm trying to think. I've used it for people with sleep issues. I've used it sometimes. I use it all the time for smoking. I use it a lot for smoking. But there are two essential elements to how one uses hypnosis. There's the way I do it, and there's the other type of hypnosis. So when you look, if you were going to go Medscape this, you'd see that hypnosis is either hypnosis in order to access the subconscious in order to do psychoanalysis, which is to find out what is the subconscious reason for people doing the things they're doing. That is what a therapist does. That's not what I do. So that would not be something I would try and do, because I wouldn't know what to do with the information they're telling me about what happened when they were young, etc. That's not what I'm doing. The other type of hypnosis is to use hypnotic suggestion to make suggestions in your subconscious mind that you actually agree with. So again, I can't make you do anything you don't want to do. That will help you, it will shape your behavior, it will reduce certain urges to do certain things, and maybe you're more likely to do other things, but you have to want to do that as well. So the smokers who don't want to actually smoke, it's very hard to hypnotize them, because their conscious mind is going to overrule that. So the evidence for hypnosis is actually quite a lot. This is from, again, this is all old stuff. So we have the Lancet from 2000. This is a randomized controlled trial. It's 241 patients, and they're undergoing a pretty painful procedure, percutaneous, meaning going through the skin. And what they showed was that in the group that got hypnosis, there was a 50% reduction in the amount of pain medications that were needed. And this was because the hypnotic group was being taught how to reduce their pain and see it, lots of different hypnotic ways to get someone to reduce the pain that they have in their body. And then this is, equally as old, because this was when in the 1990s, when they looked at acupuncture and they looked at hypnosis. This is when they made these consensus statements. And so they found strong evidence, this is the National Institute of Health, for relaxation techniques in chronic pain. So, for example, strong evidence for hypnosis for relieving pain in cancer, for example. So pain is another well-known one that you would use hypnosis for. So hypnosis and anxiety. So this comes from the Journal of Pediatrics. And this was 27 kids who were going to get bone marrow biopsies. That's aspiration of the bone marrow. It goes on in the hip here. It is super painful. And the other 22 didn't just get bone marrow, they actually got a lumbar puncture instead. None of these are fun. It's not something you want to sit there and do on a Saturday night. And so these are extremely painful procedures. Now, what they found was a significant reduction in both anxiety and pain when you did hypnosis in both of these kids compared to not doing it, to the kids who didn't get this. Kids are actually very good to hypnotize because most of them have an easy time getting into hypnotic state. So when we look at substance abuse and hypnosis, firstly, this is not new at all. It's actually very, very old. In the 19th century, this was used very often for people who had substance abuse issues like alcohol abuse. And the case reports, which were, some of them were very large, of hundreds and hundreds of people, showed an 80% success. So again, that was case reports. That wasn't randomized controlled trials. That was 100 and something years ago. So this is a study that was done about 18 years ago, and it was published in the American Journal of Clinical Hypnosis by one of the it's a PhD, so it's like a therapist who's doing hypnosis. And this was a case series of 18 people. And if you look at their substance abuse challenges, it's alcohol for most of the time with some cocaine or some marijuana. And what they got, similar, I suppose, to the NADA protocol, is it's 60 minutes 5 times a week. So this is very intensive therapy. You're going to do the hypnotic thing. You're going to do the hypnotic session 5 times a week for 60 minutes. And then, unlike NADA, which is 5 times a week for 8 weeks, this was 4 weeks. And then afterwards, they got the hypnosis as needed. And what you found is that in terms of recidivism, there was, again, a 77% success rate over that year. So there's no question in my mind that if you do it enough, the hypnotic suggestion becomes very profound, very deep, and that can change behavior for people who are wanting to do that. It's an aid. It's not the be all and end all. So what we do at the center is, and this is what we do as me, basically, is I combine the two. And the reason I combine the two is because acupuncture can make you relaxed. Part of hypnosis, there are 4 elements to hypnosis. You have to induce, then you have to deepen, then you do the actual hypnotic work where you're putting in, where you're making hypnotic suggestions, and then you have what's called termination, where you slowly bring them out of this hypnotic state. And the beginning, which is the induction, can take quite a while. We've all seen people on TV doing hypnosis where they're sitting there with a clock and they're going like this, and that's actually one way to do it. There are other ways to sit there and induce the hypnotic state. What I find is that most of what you're doing when you're doing induction is you're trying to get the person relaxed. And so you can bypass that by about a factor of 5 if you do acupuncture, specifically ear acupuncture, because by the time you come back in the room, I didn't have to persuade you you're relaxed. You are relaxed because I just gave you auricular acupuncture and you're all nice and cozy, and that's going to be a much easier time to actually be able to do the hypnotic session. We're going to do a demonstration in a second. I just want to see if anybody has questions so far. Now, how do I, 1 second.
I do have a question.
Surely. And then I'd like to, if I can.
You want me to wait? I can wait till after.
No. You go right ahead. You go right ahead. And then we'll do it. We've got plenty of time. So then we'll do a little kind of, it's going to be more guided imagery than hypnosis. Yeah.
Okay. So just a question about the timing of, if it's an hour-long session with the patient, what part is the most important part? Is it the deepening part? In what process do you take the most time? Just out of curiosity.
Yeah, so Stephanie, it's a really good question. The answer is basically this. The most important, in my opinion, is going to be the actual work of doing the hypnosis. In other words, after you've done induction and deepening, you have to then do the hypnotic suggestions. That's actually the whole point of doing it. So getting into a hypnotic state just to get you feel relaxed is great. But if I didn't make a hypnotic suggestion, then when I finish, your subconscious didn't get any new message telling it to, if this happens, then you'll do this. The reason why it takes a long time, by the way, 60 minutes is a little long. You can do hypnosis probably in about 30 to 40 minutes is kind of the average. My experience is that most of this is taken slowly, inducing a hypnotic state, and then deepening is where you get deeper and deeper. So for example, the deepening thing always, it's the same visualization. It's always going to be some form of going downstairs, going down an elevator, but you're going down and down and down, and and the whole thing is that you're getting deeper into this hypnotic state. What I find is most of the time it's taking that long. The actual hypnotic hypnotic suggestions are actually, you do that a couple of times, or you sit there and go back to it. It depends on what you're saying, because you're saying different scripts. Over time, you use scripts, but you can also, frankly, once you've done this a lot, I've done thousands of this, you can pretty much do hypnotic scripts, depending upon what you're trying to achieve. You could do this without the need to actually go get a script. So when you first do it, you're literally getting a piece of paper that you're going to read when once the person's there, to specifically hit all the points. And then over time, you get used to the fact that it's the same kind of general thing, and there's a certain language that you use. And so depending upon what you're trying to do, you can modify it. So it's interesting, because to answer your question, I think that they're all very important, but the actual bottom line is the hypnotic suggestion. Hypnotic suggestion is where you really want to do the work, but it takes a long time to get there, and that's why acupuncture is useful, because you're cutting a lot of time in induction.
Thank you.
Yeah. Other questions? Oh, okay. So why don't we do what we're going to do is we're going to do it's really just an experiential, and so I'll tell you exactly what I'm going to do. I'm not really going to hypnotize anybody, because I'm not going to go through all the steps of hypnotizing somebody, because I don't know you, and I don't know what I'm going to do when I hypnotize, and am I going to access your subconscious, and is that a good idea? So I'm going to give you the general concept. So there are some contraindications to doing hypnosis. You can't do it on anybody who is any kind of psychotic issues. Anytime I had any patient who's schizophrenic, I wouldn't do it unless I spoke to the psychiatrist, because you don't know what kind of worms you're going to open up when you access somebody's subconscious mind. So generally what we're going to do today is more of the concept of how you would get into a hypnotic state, which is a progressive muscle relaxation exercise, followed by guided imagery to visualize something. And in that state, I'm hoping that we're kind of visualizing what I'm describing, and that is somewhat close to what a hypnotic state feels like. What we would then do is, we're not going to do it today, but if there was a specific thing that we were working on, for example, it was the last patient I had today, it was to do with stress eating. So there's a whole load of things that I then say under hypnosis about her relationship with food and general positivity, and that certain foods she doesn't need to eat, and everything's, you don't make any phrases that are going to sound harsh, and everything is suggested in a certain way, and it actually changes her behavior in terms of her stress eating. So she stress eats less. I've known her for a long time, and when she does this, she comes in, we do hypnosis, and then her behavior is a little bit more kind of calm. She has more control over what she does. So so does anybody have an issue with a beach? Because you don't want to take someone to some place that's not relaxing. You know, good. All right. So we can do a beach, because the beach is an easy one. So what we do is, you know, it's probably easiest if your legs are uncrossed and you put both your feet, if they're not already on the floor, just on the floor, and you can put your hands in your laps, because you just want to be comfortable, and you want to be relaxed. And then you can certainly keep your eyes open or closed. I like to keep my eyes closed because I like to just concentrate on what I'm saying. So, and we're gonna begin. So now, let's begin to notice the sound of the breath, letting all other sounds, all other thoughts to just drift to the back of the mind. Taking a deep breath in. And as we let out the breath, perhaps we'll begin to feel the sensations of relaxation entering the various muscles of the body. Perhaps it will begin with the tiny muscles of the forehead, as those tiny muscles stretch apart and become more at ease. And now this wave of relaxation moving down to the nose, and down to the bridge of the nose, as the muscles of the face, they too become more and more relaxed. And now this wave of relaxation moving down to the jaw, the muscles of the jaw hanging slack and limp. And now this wave of relaxation moving down to the neck, and down to the shoulders, any tension, any tightness, just drifting away. And now this wave of relaxation moving down to the chest, and down to the stomach and to the belly, and at the same time down the back and the lower back and the sides of the back, so that now all the muscles in the upper body all becoming more and more at ease with every breath that you take. And now this wave of relaxation moving down to the legs, and down to the back of the knees, and down to the lower legs, and down and down and down, until finally this wave of relaxation reaches the very bottom of the legs and the tips of the toes, so that now all the muscles in the lower body all becoming more and more comfortable, more and more at ease, free from tension, free from stress, free from strain of any kind, calm, serene, resting peacefully. And perhaps at this moment you might notice that the body's become very still. You know that you could choose to move any muscle in the body if you chose to do so, but perhaps instead you'll choose to remain completely free of movement, free of conscious effort of any kind, just allowing the sensations of stillness in the body to increase. And the greater the sensation of stillness in the body, the greater the sensation of stillness in the mind and in the body, going deeper and ever, ever deeper. Your mind becoming at calm, your mind becoming at ease. And perhaps now in your mind's eye, you might be able to see a beautiful scene, perhaps a place you've visited before, a place associated with quiet and with calm, with relaxation, with balance. And you find yourself lying on a golden sandy shore. The soft, warm sand, elevating, nurturing, healing your body. Above you is a clear, cloudless blue sky with a golden sun. You can feel its rays shining down, warming your face, warming your skin, warming your hair. There's a gentle breeze. You can feel it in your body, and breathing in, you can smell the smell of the sea in your nostrils and your breath. Just the sound of silence, interspersed with the sound of the waves as the blue, warm water slowly laps against this golden sandy shore. This is a place of quiet. This is a place of calm. This is a place of peace. So I'm going to remain silent for a couple more brief moments so you can fully appreciate your own private place of serenity and peace. So now let's begin to come back into the room, back into this time, back into this place, but taking with us all the feelings, all the sensations of relaxation we've enjoyed during our time together. I'm going to count down from 5 to 1, and as I do, we're slowly going to come back to the sound of my voice, counting down from 5, now to 4, still feeling very relaxed, and 3, all the muscles awakening again, and 2, and finally to 1, coming fully back in the room, back into this time and place, feeling relaxed, comfortable, and at peace. And whenever you want, feel free to gently open your eyes. Hopefully you're a little bit calmer, and hopefully you are able to visualize a beach. If you can visualize a beach, you can visualize things. And if you can visualize things, then it's going to be easier to be able to do hypnosis and to assimilate hypnotic suggestion. So that's kind of just an experiential of what we do. The hypnosis is using acupuncture as well, and it's much deeper, and we go on for longer, and we have specific hypnotic suggestions that we say, but that's the general concept of how that would look.
Oh, that was great. Now, there are so many. So I'm just going to be say I'm a patient. I have anxiety, and I want to reduce it. And you are, I mean, you could just say, well, maybe the acupuncture would work, or maybe separately hypnosis, but you combine them together. But say, so I'm a patient, I come in, how many sessions will it take, do you think? Is it somewhere between 6 and 12? And then what is the home practice part involved? I kind of think that there would be tapes, I mean, not tapes, but, there'd be recordings that you would be listening to at home.
So all great questions. Generally, by 4 sessions, usually every week, by 4 sessions, if there is no change in the behavior, I'm not sure this is working. I mean, I was trying to think of some cases of hypnosis that I did. So for example, I had a lady who had fear of bridges. And so, it was kind of play on agoraphobia, and she couldn't get across the Tappan Zee Bridge, but that was a problem because her work was the other side of the Tappan Zee Bridge. It's a big bridge. And so what we did is we, in hypnosis, we got her to be able to access her serenity place, so that were she to start feeling anxious as she's driving, she'd immediately then be able to start to go into a place of serenity. And we worked on it long enough that in the end she was able to drive across the bridge. Now, was this a wonderful experience for her? Is she now the happiest person driving on a bridge? No. But can she do it? She can do it, because what we did was kind of counteract this panic that she had by teaching her body through her subconscious mind to put her into hypnotic state. The hypnotic state, by the way, is the relaxation state. There's a defined physiological state that we've known about for 50 years, worked by a guy called Dr. Benson at Harvard, on what actually is the relaxation state. So we know actually what it is. There are two parts of the nervous system: the automatic or autonomic nervous system, the parasympathetic and the sympathetic. And we know that the parasympathetic nervous system is actually the vagus nerve is stimulated when you are in a state of relaxation and literally calms you down. And so the relaxation state is doing that. And lots of different alternative modalities get you to the same place. Doing yoga, at the end of yoga, when you do shavasana, you are basically in a relaxation state. Doing acupuncture gets to the same place. Guided imagery, hypnosis, they all get you to that state. So it's 4 to 6 kind of sessions. It's either working or not working. And a lot of the time, if it's anxiety, what you're trying to do is get them to be able to automatically go into their relaxation state. I mean, like I've got an 18, she's now 19-year-old right now. She's a very competitive figure skater. She was in like the junior Olympic team, and she was having panic attacks on the ice. And so, as I said, a lot of the time, it's other doctors who send me. So this was a pulmonologist, because she'd been worked up and she did not have asthma, she did not have, reflux or any other things. And they realized that this was an anxiety state. And the best way to treat it was not, let's take Xanax, because the kid can't skate Olympics, level skating if she's on drugs. So they asked me what I thought, and I said, we're going to do some hypnosis. And that's what I see her. She does that to sit there so that she learns to access the relaxation response and getting to that relaxed state when she starts to feel the beginning of anxiety. So, after about 4 sessions, we should be seeing some kind of clinical response. If we're not seeing it, then it's not working. And lots of people get recordings. I just record what I'm doing, and then they listen to it at night. The smokers all get that. If you're smoking, I'm going to give you a recording, because I want you to listen to it every night until this becomes, one of the hypnotic suggestions for smoking is absolutely horrific. It goes like this. You literally, in hypnosis, after about 15, 20 minutes, you're going to say something like, putting your mouth around a cigarette is just like putting your mouth around the exhaust pipe of your car. And so then you want to visualize that, because basically it's gross. And I always think, God, but that's what happens. And that's supposed to turn you off, because I don't want you to smoke. So smoking is complicated, and it doesn't just work because you hypnotize someone. You have to do a lot of other behavioral things, in the same with every other substance, and challenges with substances. It's not just going to be a little hypnosis and acupuncture and we're done. That's not how things actually work. It's actually a whole picture. You know what I mean? It's the whole person, because we're complicated people.
So your approach of using both acupuncture and hypnosis sounds pretty unique in this whole country of doing this. And how did you learn this? Did you do this when you were working for Andrew Weil?
No. So my acupuncture training, my fellowship was basic training in 6 months of nutrition and botanicals, and getting a fundamental understanding of all the alternative approaches. But if you wanted to kind of more focus on things, then that was additional training, because acupuncture was, it was 6 months of training at sunny downstate to be able to do acupuncture. Hypnosis actually took longer, because you had to do these, the actual training wasn't very long. It was only like 60 hours of training, but then you had to be supervised for like, I think it was like a year or 2 years, and you had to go and with your supervisor, and they had to a bit like psychologists, and you had to supervise for 2 years before you could actually become properly trained. How did I put the two together? Is as I was using auricular acupuncture, it became apparent to me that it was going to be much faster and potentially more effective to do inductions with acupuncture than doing them by yourself, because I have to persuade you you're relaxed, and I go on for 20 minutes transcribing this and that and trying to get you deepened, etc., and it just cuts things much shorter if you use acupuncture. So I find that it's just a little bit more effective. I don't know who else does it. I've got no idea.
Anyone else?
I just have a comment on the hypnosis part of it. I practice refuge recovery, and there's always a meditation in the beginning. And I felt like this was, different in that you weren't focused on the thought so much, where you were saying that, but I felt like I was focused more on my body and the going down, and it was really intriguing, and it was also much faster and effective. Not that that's an amazing other practice, but I think it's probably a little different than actual meditation. Is that right? Or is this like a quick technique to get to the subconscious?
So Stephanie, firstly, thank you for telling me that it was enjoyable. The first part of what we did was progressive muscle relaxation. And that again is Herb Benson at 60 years old. This is, I'm not making this stuff, it's not like I came up with this. The only thing I came up with was combining the two things together. But right. PMR is the way, frankly, that they first started progressive muscle relaxation. They started the relaxation response. It's a little different from the way he did it, because what he would do is, you'd focus on each muscle. And what he would do actually was more contrast. You would tighten it as hard as possible, and then you relax it, and you'd be able to feel the difference between relaxed and not relaxed. Because humans in general, and people in Fairfield County in particular, actually have no concept of what relaxation feels like. Unless they actively pursue it, they don't know what the feeling of relaxation is, because they're most of the time never in a relaxed state. And that's why it's shocking for them when they actually are in a relaxed state. I don't mean sleeping. That's a different state. That's a sleeping state. This is the relaxed state. This is the sympathetic, the parasympathetically dominant state. So what we're using is progressive muscle relaxation, just a different riff on that. I would say that where you get in meditation is the same, you're still accessing the same relaxation response. So it still gets to the same place. It depends on what you're doing though, because in hypnosis, I'm not just trying to get you relaxed. I'm actually trying to have an effect by making, like, in other words, so there's this thing called guided imagery, which we kind of just did, where I describe to you a beach. And you go to the beach, and it's guided. It can be self-guided. You can do it yourself, and you can listen to tapes and whatever. But guided imagery is generally that, and it's a very nice, relaxed thing. Hypnosis, I'm not just getting you there. I'm getting there for a specific purpose, because in that state, I can access subconsciously, and I can give you hypnotic suggestions that will change your behavior. That's a little different from everywhere else, but you're still going to get to the relaxed state. But it's just that we're doing something a little bit more nuanced with hypnosis. So, in meditation, you're getting into the same state, and that's great, especially mindfulness, and I'm a big fan of meditation. But again, at the end of this, I'm expecting you to change your behavior. So, for example, mindfulness to meditation can help, and it can help with substance abuse as well. It can help with arrhythmias, it can help with blood pressure, and it can help with anxiety, and that's all true if you do it, daily for 6 weeks, etc. But that's not because the behavior's changed. It's because you've learned to get yourself more. You are spending more time in a relaxation state, and therefore that's better because the relaxation state is associated with reduction in blood pressure and reduced adrenaline and cortisol and all of these other hormones. But the hypnotic state is not just to do that, it's actually to make a change in your behavior. So it's a little kind of nuanced.
Okay, I get it. Thank you.
Yeah.
Aileen?
So you had mentioned earlier that you were working with someone who's a stress eater, and that you've been working with her for a while. If this doesn't work right away, I mean, does it lose effectiveness over time, or does it gain effectiveness over time?
It's a really great question. So the answer is that over time, much like the COVID vaccine, it doesn't work. And so
I think I heard that somewhere. That's why I asked the question.
that's right. Yeah. So I find that people will come back 100%. And so listen, I've got loads of patients I do hypnosis on. The reason why I was telling you about my 531 is because apropos to what you just to what you said, actually her story was that we worked together. She was in Chicago and did really well, actually got her stress eating under much better control, lost about 20-25 pounds, came to Connecticut, not to see me, but came to Connecticut, hence I was able to see her, and actually in person. And her relationship with food is not always very healthy, and so her stress eating behavior started to come back. When she'd first been here before she moved to Chicago, we'd done some hypnosis, and it worked extremely well. But there is and so now literally she came back so we could do it again, some more sessions, because again, the one thing I would say, Aileen, is that I personally would not change the hypnotic suggestion. So in other words, if I'm going to say X and it's starting to wear off, I wouldn't change it. I would say X again because I want to reinforce the hypnotic suggestion. You know what I mean? I try and make this relatively simple. You can do loads of hypnotic suggestions. I find that that's just a bit much. And I'm trying to make this as simple for the subconscious to say, if this happens, were this to happen, you'll start doing X. And I don't want to give them 17 options because then the subconscious doesn't know what to do. So generally, I keep to the same hypnotic suggestion, and they might come back and then I'll do it again. It's funny because there's a slightly amusing story. As you can tell, I'm British, and so I have a British accent. And I had this, I just remember her so well. It's an Indian dentist who, she actually, it was actually quite hard for her to lose weight because she has rheumatoid arthritis and she's on steroids, which are a weight killer. To lose weight, you're going to gain weight with that, but she managed to lose weight. But so we had to do hypnosis because there was always like cookies and stuff in her office as a dentist. I suppose that was to drum up business or something. I don't know what that was about, but the point was that's where it was. And she was always eating it. And then, so I spent a number of months doing hypnosis and making hypnotic suggestions that would make it, she didn't need to eat this certain food, etc., etc., etc. And she comes back, so I should never forget it, because she said to me, this is working and my behavior is I'm finding it easier to say no to certain things. But the reason why I know it's working is because I hear a voice in my head, and it's an English voice saying, you don't need to eat that. Now, it's not an American voice and it's not an Indian voice because she has an Indian accent. So it's neither of those. So the only person is I'm making an hypnotic suggestion that actually got somewhere. So, so yes, I think it works. It does not always work. I mean, there's plenty of people where it just does nothing. I do it 2 or 3 times and it clearly has no effect. The other thing I have to say is if I can't get you into a hypnotic state, I can already see, because the moment I turn the lights up. I do use lights. They go on and off just to have a darkness when we do this. And when I come back, if the person's kind of sitting there or about to jump on their phone, there's no way they were hypnotized. There's no way. You know, that's not how it was, because you have to get back in it. You've been in another state and now you're in this state, you know.
So, the support group is for parents of addicted children. Have you gone to like a rehab and done this for the whole crew or all the residents? I mean, do you do it in mass or do you work one-on-one?
No, it's one-on-one. I once did a mass. I tried to do I was giving a lecture to like 150 people, and so I did a hypnotic session with 150 people. I don't know whether that actually is particularly effective. So I did give grand rounds on this at Silver Hill. To the staff of Silver Hill about, actually, it wasn't just about hypnosis and acupuncture, though it was a lot about hypnosis and acupuncture. It was actually about the integrative approach to substance abuse, because there's nutrition parts to it, and exercise and stress management. And, again, we're complicated humans, we're complicated people. And it's about everything, how you eat and how you sleep and how you move and how you deal with stress and your relationships. And this is just one technique that is part of the armamentarium. This is the nice thing about integrative medicine. And there may be drugs that you need to use, and that is absolutely fine, but it won't just be only drugs. It'll be everything. Because you need to have a lifestyle overhaul, you need a makeover, you know what I'm saying? And that's what we're really in integrated medicine trying to do. And it's not just, you got to eat vegetables. I wish it was just you eat vegetables. You have to eat vegetables and lots of other things, and you have to do it all together, because you're trying to move us from here to here. You're trying to move the whole picture. And that's really what integrated medicine is trying to move this picture to a healthier, a happier, healthier, more balanced version of you, which everybody deserves.
Lisa?
You talk about it too at the beginning. It sounds like it's a very intensive process in the first 2 to 4 to 5 weeks, from what I hear. So to point to Eileen's point, I'm just wondering, like in a rehab facility too, I mean, I could see this being exceptionally beneficial in a rehab facility, and I've had a child in and out of so many at this point, and I would like to see approaches like this happen. But as part of that problem is that this only usually works when you really do it intensively for 3 weeks, 4 weeks. Is it
the
something
data
that worked?
right
Go ahead.
right so Lisa, so the data that I presented was definitely intensive. I mean, this is, the hypnosis was daily. It was this guy doing daily hypnosis for 5 times a week. There was the same thing with the NADA protocol. That's an hour 5 times a week, between 4 and 8 weeks. Definitely. So a weekly session is cute, I think, when we're in rehab, in a more kind of acute section, setting. You need much more intensive hypnosis and acupuncture to be able to do this. I still think they're very legitimate. I think that they're interesting things to investigate, whichever facilities that you are, familiar with, etc. As do they offer this? And I'm sure some of the good ones probably would see some benefit. And you could certainly ask them in terms of some of the addictive behaviors, what if they're doing NADA protocols, because this is not like just us. This is done in Lenox Hill. This is done, people know NADA. And there's no downside. It's ear acupuncture. There's only one thing bad that can happen. You can bleed. It's not the worst thing in the world. The needles are minute. If you bleed, it's going to be a drop of blood. I mean, this is, in the big. So I think this is the hypnosis is a little bit more nuanced, because you probably would want to have, you wouldn't want to have me doing it. You'd want to have probably a psychotherapist, because people with substance challenges, issues with substance abuse, there's probably more from a psychological point of view than I'd be able to deal with, and getting into their subconscious could be something I wish I hadn't done. You know what I'm saying? That's not what I'm trained to do. That's not what I do. So that would be better with one of their therapists, but I think it's totally legitimate to do that, so it's an exciting thing.
Well, Joe, if you have a few more minutes, just a couple more things. There's the kind of hypnosis that you do in the office, but there is a self-hypnosis approach.
100%.
and I was listening to Marissa Peer on a podcast. Did you ever hear of her before? She's British, but it's more about part of personal growth. Say, if you're trying to personally grow and you want to start making speeches, and then you do these affirmations using listening to suggestions that make you over time just feel so comfortable making speeches in front of large audiences, things like that. So
very similar concept.
Okay, so so there is that kind of way of doing it, and then you would actually create a recording of your own voice saying these positive affirmations, and as part of a process of getting into a relaxed state and then listening.
Yeah,
it would be a DIY, and I'm just wondering what you think.
Yeah, Paul, the thing is that so there is definitely, I have done hypnosis with people who just, I think of one lady and she just wanted, things weren't going well for her. She wanted to be able to visualize herself 5 years in the future, looking in the mirror, and so we do a whole, fine, let's do that. If that's going to help you change your behavior and make you more motivated to do X, Y, and Z, I'm all in. Generally, my hypnosis is much more targeted. So I'm there to do a specific thing for a specific problem, rather than a general thing where, I want to feel a better version of myself and I want to be able to go, I've done that plenty of times, but I'm usually doing it because it's, this person wants to stop smoking and I'm going to try and change that behavior. This person's stress eats, I'm going to try and change that behavior. This person has panic attacks, I'm going to try and change that behavior. So it is kind of quite clinical, and it's targeted in the sense that my hypnotic suggestions are relatively individualized and very specific, because I'm trying to do one specific thing, like the skater. You know what I mean? I don't, yes, we can do some general stuff about, and she's in this relaxation state, et cetera, and she's relaxed and it's all good. That's just general stuff that you always say. But there's a specific part where I'm going to make it hypnotic suggestions, and they're very, very detailed to what this behavior I want her to do. Do you know what I mean? Okay. So, but I still so in other words, self-help hypnosis tapes are great. They are generic. There's nothing wrong with that. And if you're doing something that's generally going to be a good, positive experience, I think that's absolutely terrific. And I like the idea that you're going to get hypnotic suggestions that'll tell you to do behaviors that are health affirming. I'm doing something very specific and targeted, and therefore it wouldn't be generic. Because I know the patient and their behavior. So I'll give you an example. I had a guy, just a final example, and then you'll see what I mean. This is a funny story. So this guy, he's 17, and his mother takes me here, and he sleepwalks. He sleepwalks, which is fine. A kid from New Canaan, just by the way. And he went to see, I actually got a load of referrals from our sleep lab for this type of behavior, and because they like hypnosis, because sleepwalking is a completely subconscious thing. You're not deciding to sleepwalk, and he'd go downstairs and he'd eat some food, and in the morning he'd find it, and they thought it was rats or whatever. No, it's not, it's the sun or whatever. But here was the thing, and it's kind of funny, but it wasn't. He was going to camp, swear to you this was the story, he's going to camp in Scotland, and the camp was in a lock, it was on the lock, right? And they were literally terrified that he was going to leave his tent and go drown in the lake. I mean, literally, I'm not joking. So we spent a number of months, and this was specifically, and it was specifically the fact that I was trying to get him to stop the sleepwalking in New Canaan, so he wouldn't leave his tent, because his mother was literally petrified she was going to get a call from Scotland that he drowned in the lake. So so in other words, what I'm saying is that I use it more for these kind of things than the more generic, but self-hypnosis tapes I think are great.
If someone does come to you with more on the insomnia side, or wanting to get more sleep, what would you what would you, in your integrative practice, what would you use the most?
I think we go, so firstly, we're kind of very into sleep hygiene, and there's people's sleep hygiene is pretty horrific. And I might, depending, I mean, I don't think it's a generic approach at all. I would probably not do hypnosis. I want them to have some mastery over their ability to soothe, to quieten their mind. So if I just get them to do that because it happens automatically, that's very nice and very passive. So I'd rather actually teach them some mindfulness, because that's some basic mindfulness meditation, which you can learn. It's very easy to actually learn them. They have to learn how to switch off their mind. You still have a problem with the fact that you have the actual sleep cycle starts with a reduction in the ambient light, and increase in melatonin, and increase in GABA, and all the other inhibitory neurotransmitters. All of this is happening, and so you may have to use some supplements, and that might be magnesium glycinate, and that might be melatonin, and it might be hops, and it might be valerian root. I mean, whatever it is, depends what drugs they're taking. But what we're trying to do is quieten their mind, quieten their body in a situation where they are actually able to sleep. So where are they sleeping? How is it the right temperature? Is it the right bed? Is it the right, what are they doing? And it just, you've got to seduce your body to go to sleep, for some people. And sleep hygiene's like the number one part of all of this. There's a very interesting new technique that has really quite good evidence called CBTI, which is cognitive behavioral therapy for insomnia. And it's really got some good studies now. It's certainly worth something doing. And that's something that honestly, you could probably do CBTI online. You'd find a practitioner. And one of the things is that they give you permission to not sleep, because people get so worked up about not being able to sleep. And that's the worst thing. You can't get worked up about it. You have to be cool. As I say to my kid, and she gets so annoyed when I say, just be cool. There we go. Perfect.
Yeah, this was great. Any other questions, Lisa?
One more, just more going back to acupuncture itself. I'm a huge acupuncture believer. I've done it 3 or 4 different times for different things. But my understanding for addiction, again, that whole inner ear is a very persuasive part of where your acupuncture can be helpful to addiction. Is that your experience?
So the research on NADA is pretty good. I don't understand why more people don't do it. I think in some of the good rehabs, it's my understanding they probably do have acupuncturists doing the NADA protocol. It's just you want to make sure they're doing the actual protocol, not just making it up. Like, there's data. Let's follow the data and do the way it is. So NADA has data to it, and has a trial, so it's worth doing. Again, there's no downside.
Can you give any explanation to why the ear is so helpful for addicts?
Oh, why? Well, I mean, generally, so the ear is the ear is a microscopic, it's a microcosm, if you will, of the entire body. So actually, you can treat the whole body acupuncture purely through the ears. The ear is an upside down human, and so the points are, this is the head, and then this is the back, and so why it's more effective, I don't know. I think they're probably smaller needles and more gentle. But there are relaxation points on the body. It's just that these are smaller needles, and they seem to, and that's kind of the protocol that we use. If you ask a traditional Chinese medicine doctor, they're probably able to tell you why specifically auricular acupuncture works better than, for example, there's acupuncture points here for anxiety.
Oh yeah.
I don't use them. You know what I mean? I always use ear ones. So I'm not sure I have an answer. I'm sure a traditional Chinese medicine doctor may be able to give you a better explanation. But the data is definitely there.
And are you able to suggest any traditional acupuncturists, doctors that have worked particularly with addiction in the area?
I have someone who I like very much, but I've no idea whether she does addiction medicine. I wouldn't know. I'm going to give you the name of the acupuncturist we like. Her name is Eileen Karn, Karn, and she is in Stamford. And she's properly trained and she's very good. I have no idea whether she has experience with addiction and NADA. You don't have to be a traditional Chinese medicine doctor to do the NADA protocol. It's actually very easy because it's just to learn how to put in these 5 needles. So I don't think you need to go and see someone, Eileen, for that. I think what you do is if you're dealing with a facility rehab, you want to ask if they have someone who does NADA protocols, and it'll be one of the nurses. It's very simple. It's like a 2-day thing.
Right. No, and I understand that, but if you're going to ever bring your child back home and then try to keep some training here, you're always looking for. I mean, obviously, ideally, that's what we want them to be able to do is live back at home.
Amen. Amen.
So, thank you.
You did both together. I thought you did both together.
I do both together.
He does.
Yeah, I do. Hypnoacupuncture, 100% do it right together. But that wasn't the question.
Okay. And then if the addict doesn't want to get help, it doesn't work.
I don't know how that's going to work for hypnosis. I just don't know what I mean. A very good, experienced clinical, hypnosis practitioner may be able to. I don't know how that works. The people I see, kind of by definition, they have to have some kind of urge to want to do this, because if not, the if you consciously don't want to do it, you're not. Then there's no subconscious. The urges. I might give you an urge to do X, but if your conscious mind doesn't want to do it, you don't do it. Do you know what I mean? I'll give you an example. I don't know whether you have intention to, like, you see a red light and you're like, screw it, no one's around, I'm just going to go through the red light, but in the end you don't do it. There's all these things that we have urges to do but we don't do. I suppose it's kind of the same thing, because our conscious mind can clamp down on what we do. We're not id. We don't just do whatever we want. And so the conscious mind is still going to be there. I'm making subconscious hypnotic suggestions that can be easily quashed if the person doesn't want to do them. So I don't know how that would work, frankly, with someone who doesn't want to do it. I also don't know whether I'd even be able to hypnotize them. Yeah. You know what I mean? It's the stage hypnosis. I mean, frankly, a lot of the time it's volunteers and they're already half there anyway. There's alcohol involved, and so I don't know. I mean, the whole thing in the clinical hypnosis was that you specifically don't do anything like that. You don't use your training to do anything that's vaudeville.
You brought up very low levels of electricity and
for stimulation,
acupuncture. But what about, have you heard of other methods of putting electricity through the body in different ways that do help with, substance use or addiction? I mean, I can give you, have you heard of that at all?
I have heard of this. I have not gone into detail to have a coherent opinion.
Yeah. Okay. Okay.
Yeah.
So it is, well after 8. I really appreciate, Joe, that you stayed a little bit longer to go through this. And you are easily found at Stamford Health, just your name and Stamford Health.
Yeah.
Okay. Bye, Suzanne. I'm glad you found it helpful. And so you're easy to find, and your office is in the Tully Center there?
That's correct. Yeah.
Okay. And you also teach at Columbia University?
Yeah, we teach the medical students and the residents and the fellows.
That's great.
Yeah.
What ones that are looking, is this just a primer on integrative medicine that you're teaching? Or
the medical students, yes. The residents, usually they're more interested. The fellows we're training them. They're not just interested. This is their chosen profession.
Yeah, kind of like what you already had gone through.
Yeah.
Okay.
My great pleasure, guys.
Yes.
Yeah. Good luck.
Thank you. Thank you very much.
Thank you all for organizing.
All right. Have a good evening.
Oh, great pleasure.
And good holidays. Bye now.